Okay, hi all. It's my pleasure to be with you and within a group who really would like to do a change and impact in neurodiversity field. So that's why I'm so happy to present also my research work. My research topic is about through ADHD eyes, and I will explain later what that means. It is about mapping the adult ADHD healthcare journey in Netherlands. About me more. Yeah, here we go. Who I am? I'm Tahani. I'm a medical doctor, and I did my master in public health here in Netherlands, Vrije Universiteit. Also, I am research fellow at Neurodiversity Foundation. Actually, I'm a believer in the power of the visual storytelling, so that's why my research work related to some things for the visual storytelling or visual data. For those people who don't know much about the ADHD, here's some information. ADHD is abbreviation for attention deficit and hyperactivity disorder, and it is one of the neurodevelopmental disorders. That's they having they emerge in during the nervous system development. And ADHD is characterized by persistent patterns of inattention, hyperactivity, and maybe or impulsivity. And actually, those symptoms should be interfere with their life or in their work or in their academic life. So if we came to target group, which here in our research work is adult. So in adults, the ADHD mostly manifested through the executive function challenging, sensory processing differences, and also they have different communication styles. For epidemiological data, here in Netherlands, there is 2.5 to 5% of the adults who have ADHD. And it's so sad that also there's a delay of the diagnosis, so they need actually almost 7 years from recognizing their symptoms till they finally diagnosed with ADHD. Even following diagnosis, they still having a problem with the treatment option, and so this is making the things more complex. If we came to talk deeply about the healthcare barriers for people with ADHD, so actually they are facing significant challenges when interfacing with the healthcare systems because those healthcare systems are not optimally designed to meet their neurodiverse needs. Besides to that, those experiences, difficulties are not inherently to the condition itself, rather than due to the structure of the healthcare service delivery. So, and basically the standard of the healthcare system present multiple barriers for people with ADHD. So if we want to explain more in terms of the access. So the patients need long waiting periods for appointments, even for referral, and finally to diagnose with the ADHD, and also for the treatments. In terms of the communication, also because the caregivers, they communicate differently with the neurodiverse people. So this is also making the things more difficult and having an effective treatment plan. So also there are different barriers, but we have not to focus on only the deficits and the difficulties. Also, we want to check or to focus on the uniqueness of the ADHD and use them. So there is the research indicated that people with ADHD, they have much of cognitive strength that can be actually used. One of them, creative problem-solving abilities, innovative thinking patterns, attention to the specific details, and intense focus. So those characteristics, unfortunately, overlooked by the healthcare context, rather than using them to design the healthcare to meet their needs and eventually having effective care. So actually, when we try to do the much of research, so we find that there is well studied about the challenges those group faced when they interacting with the health system, but you cannot finding using different research method to express those challenges. So here, to filling this gap, so we have to do new research, and here came our research work, which is still in the beginning, but yeah, we are finally in the first time, just in preparing everything. So that's why this study came to an aim to visually capture both the barriers and the facilitator in the Dutch healthcare system for those group. And those, we hope that the findings will inform practical changes to the healthcare delivery and shifting the focus from changing the individual to adapting system that better and support those group and having neuro-inclusive healthcare system. So if we want to do that, so to mapping those the ADHD healthcare journey, this research maps three critical phases, starting by the phase one, which is the pathway to diagnose, which is recognizing the symptoms, deciding to seek help, and first contact with the healthcare and then referral process. If we come to the phase two, it's about the waiting room experience, and actually what we want to focus on it because it has different elements, and this is like the direct contact the ADHD with the caregivers. So we want to cover different elements like physical environment, sensory experiences like for the sounds, with the people around them. Also for time management, challenging, like how much they have to wait for their turn. Is there differences between the actual and the time for for the having the appointment. Also the information processing, social dynamics, like how they can contact with the people in the clinics, so and different things. Also the engagement and stimulation. If there is something they can do in the waiting room, there is like Wi-Fi, those things that stimulate to having a good vibes in the clinic. The third phase, it's about the consultation and follow-up. So we want to cover the diagnostic assessment experience and how their communication with the healthcare givers or providers, understanding the treatment options and the decisions, is they can easily decide or not, the medication experiences and the therapy sessions, and later to follow-up appointment process. So here came the idea. We want to having a different method for studying this research, which is the Photovoice. For people who don't know the Photovoice, but I have seen different presentations have already introduced some things about this. Photovoice is actually like a qualitative participatory action research approach, in which the participants, they can using photography to describe the things they cannot verbally in words describe it. So it's easily to capturing those experiences, and also combining those photos with the narrative, and this to cover their experiences and share their insights. So why I decided to choose this method rather than the traditional way methods. So this approach actually it suits people with ADHD. If we came to the skills, they have actually the strong visual processing skills. So, and this is empower them. Also the embrace their the skills they have. So then they can express their experiences with the images. Also, it has been studied that this kind of approach is really help, like it's a efficacy, and this is, I think, it done with the yeah, people with autism. Also, I think we have not keeping the information only in the papers and publishing in academic journals. It should be also for advocate to having like photos and stories, so then they can express their experiences and asking for the change. So that's why I found it is a good way to for advocate. Here an example. This is like an study, yeah, using the Photovoice to experiencing living with the chronic mental illness. It was like it aimed to enhance the level of the empathy of the professional when they meeting those patients with the chronic mental illnesses. And actually, those participants enjoy the process of taking photos to tell their story and their experiences. So, and here a type of the visual map. If you've seen, they taken pictures and write a narrative or describing about what they say. And really, this is like a new things we want to like go to their minds and through their eyes to see what the facilitators and also the barriers they face when they using the healthcare system. So if we came to the expected outcomes or outputs, it would be like we're having visual journey map that involving both the barriers and facilitators across the healthcare journey. Also, we want to have recommendations according what we already like if we're collecting the data. So recommendation related to the ADHD friendly appointment system to create sensory conscious waiting environments and also like introduce effective communications way with the ADHD people. So yeah, we like yeah, we plan to for the participant journey to be easier. So at first we will do train and prepare them. So first time we will do a photo voice training to explain more about the photo voice methods and how it works. Also, we will learn them about the ethical photography. So then the photos to be ethically can be published and can be described well. Also, like to make it easier for them, not frustrating. So for every phase we have already mentioned in the healthcare phases, we will having prompts that then they can use it to answer for the photographs or the images they will taken. So then they can answer those questions. In the second step, we asking them for each phase, they can giving two pictures or two images, and we will do reflection session, like individually, starting by the individually to know the like what they want, what the information they want to know with those images. Then we will do group discussion workshop. So then we collecting more data and describing for the photos they have already taken. In the last step, we want to collaborate with them for the theme development. And actually, this is the power things in this approach. You make those people are the co-author in the study, so they choose what they want to we us to know based on our questions, but they answer it in the way they want to change or they look at it. Also, those giving to them to empower to do this. Then we will do selection for the exhibition photo because we want also to do exhibition to show what we have already collect from photos and their narratives. So because at the early stage. So I hope if anyone interested to join this journey. So the criteria for participants, they should be adult, like positive 18 and above, and they have either self or formal diagnosis. We want to also self-diagnose because in the first phase, still when they recognize their symptoms, also we want to cover this phase. So that's why we're also asking for people, even they don't have diagnosed with ADHD. Also, they should having experience in the Dutch healthcare, which we aiming uh, to make a change on it, and they can commit with us to having like actually not 4 to 5 months, but like to keep in touch. So this is my email and my LinkedIn. If someone like wants to participate or suggest for others. Yeah, thank you so much. And if you have a question, I will be happy.
I have one, or maybe
Yeah,
two.
hi Hans. Yeah.
These are about the misunderstanding at the care. For my research into discrimination based on neurodivergence, I also asked the municipalities in the Netherlands a number of questions about the presence of knowledge about neurodivergence under their officials. I also asked whether the municipality is consciously working on assigning cases involving neurodivergent residents to civil servants with knowledge about neurodivergence. Have you also investigated whether this assignment that I'm asking the municipalities about is also present in the care provided?
Yeah, actually, because we're starting at the beginning. So according the data we will get, if really like having like assets that we could really advocate for, then the next step we will asking, for example, neurodiversity foundations, then they can contact with having like that recommendations to change, and then we can asking the municipalities to help like doing practical movement, you know. So but because we are in the early stage, and for the ethical considerations, as like Jasmine said, um, for me, because this topic should be like really having practical improvements, you know. So the ethical consideration should be taken like seriously. And yeah, because Neurodiversity Foundation, they cannot like giving me ethical approval, so I have to check this carefully, then starting. So if we have the data that show we can change or design the healthcare, like with even like with the small things, you know, that the things they are practical, low cost, then yeah, we will maybe share with the different stakeholders to make this is real in the healthcare
It's
system.
very interesting. Maybe we can go talk about it in a further time.
Yeah, it's my
Sounds
pleasure.
very interesting to me. I use it for my research now, and I'm also developing an app for neurodivergent people where I also will hope to solve this problem. So
Yeah, thank you. Yeah, we would, yeah, I would be happy to contact you more for this. Yeah.
we are already connected on LinkedIn.
Okay.
We talked a few times during the last weeks. Now, when I hear you, I just a thought came up. That is, you're looking for people who are seeking healthcare with ADHD as subjects to your study. Now, there are also people, healthcare givers with ADHD. They might also have suggestions or even join in conversations, not just because they know the system, but also because if there are recommendations for a new design, the support by the healthcare system may be better than if the healthcare givers have not been involved. How do you see that?
Yeah, actually, like this is good things to know. Like you give me hints. Actually, if they have both perspective, like they are having ADHD, also they are working in the healthcare system, say, so they having like a big insight for the issue. But so I would love to have like also participants, they are already professional in the healthcare system, and I would love. But let's to be say, I'm not sure, but this is like point of my view. Like as a doctor, always like we are in the stressful, like in the stress. So we didn't think we didn't take in considerations like the emotionally, the empathy side of the people who are seeking the care, you know? Just like because of the stress, and we want to focusing on giving the right medication, giving the right information, listening. So some things we are miss during giving those kind of care. So yeah, we take the things like, is it a job, you know? So that's why I think they will not take it like seriously. And people, if we can say the participants who are professional or working in the healthcare and they have ADHD, actually they have access more than the others, you know? So that would be like some bias because like they can access easily. They may be having long time for the consultation because they know the people around. So this is give to them more awards than the others, you know. So then they end up they satisfy with the system, and this maybe make bias. I'm not sure if this is like convince you.
Thank you.
But I'm happy that I'm a doctor, so then I can answer this question.
I was wondering about the participants you would like to have. Do you have an ideal age range or cultural background? Because I think you are focusing on the Netherlands.
Yeah.
I think the Netherlands is becoming more and more diverse. Do
Yeah.
you take that in consideration during your research?
Yeah, actually, like, yeah, I have ADHD and I have diagnosed with ADHD here in Netherlands. Even though um, I know about the ADHD, and during like my studying in medical college, so I was having the symptoms, but I have not make attention for seeking for help, um, because that was new journey for me. So I was thinking that it was be normal. But when I came here and yeah, then I see the symptoms becoming more and more, so that I starting to seeking for help in the healthcare system. But to be not biased by my personal story, which is even if I have, this is also good to like to do such a research. But this is make more like having like background and so. But actually, because the medication not working with me, so I'm not going much and much with contact with the healthcare system. So, but I have seen, like when I went to the clinics, I have seen like there's a gaps, and I can say because I'm working in the health system care before, and I have already also like I'm specialized in the health system policy and management. So I have already that insights to know which is work or not working. So I have seen there's much of barriers, honestly. Uh, and that's sometimes I was talking with the Steve, and sometimes that not encourage me to seek for more help and like yeah for like contacting the the healthcare givers. But yeah, basically this idea it came because like still the health system is made by neurotypical people. So they cannot focusing on the details that really frustrating those people, like even the simple things we are sensitive for, which is it's normally it's okay, it's not big problem. But because this system is made by neurotypical people, so they cannot focusing for those things, really make the processing is difficult. So that's why we need to change this, because they have already the care for those people, so they have the already the knowledge, they have the everything. So then we just like do improvements to make it more effective, you know. That's it.
Okay, interesting. And are you looking at like differences between the male experience and female experience in the healthcare?
Actually, no. For me, like it could be coming with the when we collecting the data and do analysis. But for now, I think it could be play the like the gender differences play role, how they capturing the photos and how they do like explaining those images. But maybe this is things we can discover with when we collecting the data. Yeah.
Okay, interesting. Thank you.
Welcome. Yeah, I see here someone, Bolina, if I'm not wrong. She said, I'm the only one who received exceptional support with the diagnosis and treatment here in Netherlands. Well, if she could clarify this for me, it would be like good
Yeah, it
input
was
for me.
sort of without the camera, it's just not connecting
It's
right
okay.
now.
Yeah.
Well, I heard so many stories that people had to wait months to get to see the specialist to get the diagnosis, and then the struggle with getting, for example, a medication. And in my case, I mean, I just had to wait a week to see a professional. Then we worked through the protocols for 3 consecutive weeks, and then immediately I have been seen by a GP, and we started experimenting and checking which treatment, which medicine would suits me best. So I'm like in a really opposite extreme of the stories I heard.
Yeah, I'm happy to know this about you. Yeah, actually, this is maybe one phase or like some elements of the phases you have talk about it, like easily to diagnose, easily to having an appointments. But also, in this study, we want to cover the other elements or the phases in the healthcare, like for waiting rooms, some like even like our systems are varies. Like some people they have mild symptoms, some people they have severe symptoms, and yeah, and etc. So that's why processing some different things or factors that already present in the clinics, for example, in the waiting room, it would be totally different from one to another. So that's why we want to cover whole things to see if, and this is good things we know, Paulina, because we want also to know the facilitators things, which you are already say it about it. Like it was easily to get appointment, and this is good things to know also, yeah? Because
Mm-hmm.
this is also great inputs to know and enforcing for it to like to yeah to highlighting how it would be satisfying to have easily an appointment and starting the medication easily, you know? So yeah, so we covering both barriers and facilitators.
Great, thank you.
Welcome.
Well, perhaps another facilitator is that if people feel well after going through the process of co-designing a new healthcare system, at least a healthcare system that is more adapted to ADHD, they may feel more like their authentic selves and perhaps don't need medication anymore. How do you see that idea?
Are you asking me or asking Paulina, Stephen? Sorry, you are mute.
I was asking you, Tahani.
Yeah, feeling happy after you get medication. That's a question, if I'm not
No,
wrong.
sorry. Feeling happy after participating in your research, just as you project the research, people who see results are usually happy by seeing the results. That their efforts, their contribution, that it counts for something, that it has value, that it's also seen by the healthcare system, bringing some changes into effect. If this helps them enforcing their authentic selves, perhaps it results in needing less medication or no medication at all. How do you see that as a possibility?
Yeah, that's good things to talk about it more. Like when we do the workshop, we have to be open. Like they are, this is the aim of the having Photovoice. They feeling the empower to speak up, to loudly by their photos, by their insights to change, but that's mean not immediate change or not immediate, like even the improvement they feel about themselves because they are now feeling they are change maker, they having those kind of feelings. But I'm not sure, let's say they are like in the workshop we have to highlighting about this Yeah. And also, let's, yeah, how I can say it. In terms of stop medication, we have to like giving awareness. It's not about medication or not, just we want to share with us their feelings, their insights, their meanings. And this is why the photo voice is a qualitative approach, because we want to know things that we don't know. Then, but the approach, they are already on it, like having a medication, or they are on the cognitive behavioral therapy or so on. If they are happy with, so they have to be with it, because this is like personal things, you know. But we have to discuss about even like the futures. This is may or may not happen, like the change in the healthcare system, because you know that we have like more power than the things we collecting data like for years, for the decades. But yeah, we have to be open for everything, I think. Yeah, but they have to separate their personal journey about the like the personal participants in the research, you know.
Any other questions?
Yeah, I would be happy. Yeah, Daniel. Yeah, I tried to check your link.
Yeah, sweet. Just a one mark or remark. Whenever we go into science of medicine, just be aware that the data that we give out can be used in a dual use approach for or against us. Just as a gentle reminder to be
Yeah, thank
aware
you.
of that.
I'll take this. Yeah, thank you. Yeah. Is there any question?
I was wondering, when looking at the healthcare system, is there a specific part where you really want to focus?
It is like the things related to the ADHD care specifically. So we want to cover the three, as I said, like three phases. From the moments they recognize they have symptoms, and how really they seeking, then this is the first phase, to seeking the help. Like if they like easily find the information about the symptoms here in Netherlands, if I can say, and like in the Netherlands language, is there like availability of the information, if the websites is easy for them to accommodate and having the right information, like, and keeping and move on. Like then if they easily contact the house art and asking for help, and they easily understand them to refer them to the right care, and so on. So the journey of contacting with healthcare.